Hello, sir. My name's Patrick. I'll be your physical therapist today. I'm sorry to hear about what brought you into the clinic today. I would love to hear more as to what you're exactly experiencing and perform some examinations to get a better idea of how you're moving today and what's inhibiting you from returning to work and reaching your goals. That is pertinent to me as a physical therapist to get you back to doing the things that you love. So I would just like to start by talking about how pain is a very complex thing, as you may have come to be aware as you've been dealing with it for 6 months now. There is good literature that shows that what shows up on an x-ray or MRI finding might not necessarily correlate with symptoms. So if it's degenerative disease, it may just be like the gray hairs and wrinkles of us as we age naturally, and you can see that on that imaging. You may not have symptoms related to it. For your case, we may not resolve the pain entirely. However, we want to reduce those symptoms so we can slowly return back to some of the things that we love and eventually get you back to doing work full time. So when we experience a bout of pain, when you first got injured, our body has a heightened alarm system that our nerves respond as a protective mechanism. And so it seems once you've been dealing with pain for 3 to 6 months, it can be ruled as chronic. And during that time frame, there's good research that most tissue has been healed by then. So we want to work on trying to reduce the volume of our nervous system's response. It's natural. Our body wants to make sure that we are as safe as possible. And for some people, after they experience an acute bout of pain, those alarm systems just stay heightened. So that is okay. It happens to 1 in 5 people. And so don't feel like you're the only one. So we have certain tools as a physical therapist, and I'll educate you on some things that you can do away from the clinic. Try and think about certain things that you've experienced during this time frame and what you can do for yourself in regards to putting yourself in the best position. From a physical activity standpoint, we're going to start at ground zero and just really focus on seeing what you're capable of doing and try to encourage that in the best manner that we can, and slowly have graded exposure to increasing your activity levels, and we'll modulate with your pain response and try and work through a better understanding of why you're having heightened pain with certain things. And please know that I'm an open book and that you can let me know how you're feeling at any point. And if we need to bring in any outside consultations, we may surely have to exercise that option. But I definitely would like to try some of the ideas that I have that have worked for people in the past and that has good research backed on it. How does that sound for you? And I hope that we can work together to tackle your pain that you've been experiencing for a long time. Thank you.